Hi, Bob, my favorite manager. Good morning.
Good morning to you as well.
So, last episode we talked about the coughing and the wheezing, and then you went to emergency room and you had 2 runs of antibiotics. But the antibiotics kill the bacteria or virus, no, not virus, just the bacteria. But it also can destroy your good bacteria. So that way you couldn't digest well, then your phlegm will be accumulating, then it will influence your lung function. So how did you cope with all of those things?
Well, I had my pacemaker replaced, so the doctor put me on an antibiotic to make sure I didn't develop an infection. Well, I was off that antibiotic for maybe a week, and my primary care doctor put me on an antibiotic and a steroid because I was constantly coughing. And after that, I did notice an increase in my phlegm, especially when I kind of got up in the morning. And the only thing I'm kind of doing for it, or I did do for it, is trying a probiotic. I did a probiotic, and I would, for breakfast, I would have like yogurt with blueberries or maybe bananas to increase the good bacteria in my stomach. But it did take quite a while for me to calm down the phlegm.
But you took the herbs for almost 2-3 weeks, remember? And after the second antibiotics, your phlegm still not going away because the antibiotics does not clear up the phlegm. Actually, it makes your digestive system weaker. That's why so many people, they have this lingering phlegm, and then they keep coughing. And that's why so many people have this condition called bronchiectasis. So that means the phlegm accumulating in your bronchi, the small tubes in your lung. And when the phlegm accumulating there, it tends to have infection. Then it erode the cartilage of the bronchi so that periodically they will start coughing fresh blood. So bronchiectasis can be a dangerous condition because one of the patients who survived the colon cancer with a chemo, radiation, and surgery, he actually died of coughing blood from bronchiectasis. So whenever you have this lingering phlegm or nasal congestion, after your antibiotics, the herbs will help you to, and herbs itself also a prebiotic. So it gives you the good bacteria, the food, the fibers. So the good bacteria will grow, and also it brings energy to your stomach and intestines so you can digest better. That way the phlegm condition will go away so that you won't have this chronic coughing.
Yeah, I've never had anybody explain it that completely as you just did. So I know a little bit more about what's going on in my body.
Yes, you know a lot, but I think Chinese herb does not taste as good as chocolate or ice cream. So the good thing is you treat the root cause of the problem, which is the phlegm infection, and especially the virus infection. You don't really have good antivirus medication. So if you think you have cold, you have sore throat, started taking herb earlier, a few days before it goes into full-blown virus or bacterial infection. That way, within a few days, you get all the symptoms gone, so you don't have to start antibiotics. Actually, my 3 kids, I started, the earliest time I started the herbs is my daughter. When she was only 40 days, she got a lung infection, and I brought her to a hospital called Chinese-Japanese hospital, and my classmates want to give IV antibiotics, and my husband said, no, we're not gonna give this. So we brought the kids home, we cooked the herbs, and we wait when she's hungry. We give the herbs, and she drink that. And then after 2-3 days, the symptoms are gone. So when the kids are little, you give the herbs, their taste buds get used to it. So they don't think this herb, just like coffee. Coffee is bitter, you know. If you started early, then your taste bud get used to it. So the good thing about herbs is you don't have to take that forever. You take that for a few weeks, you get better, you stop. So recently, when you are in the clinic helping me, the cough sometimes get worse, the phlegm condition, and I noticed that you add almond milk in your tea or coffee, and also you start eating peanut butter. So I hope you won't do that until this phlegm condition cleared up, because those things can induce the histamine, and the histamine will causing the blood vessel leaking. So not only the phlegm, but also your joint will be aching because the histamine causing the fluids accumulating in your knee cavity. So the other thing, yesterday I saw a very young lady. She almost a vegan, but she eats eggs, and she drink almond milk. She eats the cashew and different kind of nuts, and she's so young now. The asthma becomes so bad that her pulmonary function is declining so much she cannot even dance or walk a long distance. She's only early 30s, and there's no infection. And I said, you gotta get rid of this turmeric, almond milk, cashew milk, nuts, because it induces the histamine and stimulate your immune system. When your immune system is hyperactive, you tend to develop a chronic inflammation. For her, it's not infection, it's inflammation. That's how she couldn't breathe, because the whole lung is inflamed.
How is her weight? Is her weight normal, or?
She's very skinny.
Oh,
she's a dancer.
Yeah.
She thinks she eats healthy, and she dances, she exercises, but she has had allergies since she was a child, and she does not sleep much. And when you don't sleep much, your histamine level tends to be high, and so her histamine already this high, and then she eats nuts, she eats turmeric, she drinks almond milk. All of this increase the histamine level like this. So that's how she has this phlegm, she has this asthma, allergy worse and worse. So she said, this is a healthy food. I said, yes, this is a healthy food. Do you think you are healthier than a few years ago? She said, no. Then I said, you have to change. Otherwise, your lung function completely degenerate. Then it's going to be too late when you want to change.
Yeah, some of the doctors that take on dietary plans, you can even watch it on television, they endorse the use of peanuts. So I often get the little individual bags of peanuts, and if I want a snack around 9 o'clock, maybe 9:30, I'll eat that. So I'm worsening the phlegm problem by trying to follow what other doctors say are good for dietary plans.
Yes.
So it's confusing.
Yes. The functional doctor always said seeds and nuts are good, but you have to see how much your body can tolerate. Dr. Andrew Weil saying that if you're going to eat almond every day, three almonds. Who's going to eat 3 almonds? In the almond milk, 3-4 ounces, how many almonds? 3 almonds will make that almond milk? No. How much you ingest, you don't know. So my suggestion is, if you do have phlegm, skin issue, all the inflammation related with histamine, joint pain, you stop everything. Nuts, seeds, turmeric, spicy food, alcohol, high salt, high sugar. and then for 2-3 weeks you will see the changes. And once your symptoms is completely gone, then you reintroduce maybe 3 almonds twice a day, and then that for a week you don't have anything, then you can increase 3 almonds every other day or 5 almonds twice a week. So you have to reset the point that you know how much your body can tolerate those food. Healthy food are good, but also healthy food takes a lot of work to digest.